This Good to Go segment is sponsored by Corewell Health.
The National Institutes of Health recently revised their recommendations for weight loss surgery. Here to tell us more about those changes and about bariatric surgery in general is Corewell Health Bariatric Surgeon, Dr. James Foote. Dr. Foote is a board-certified bariatric surgeon and is a fellow of the American College of Surgeons. Hi, Dr. Foote.
Hi, good morning.
It's good to have you. Having surgery to lose weight is certainly a serious decision. What are some of the things that potential weight loss surgery patients should be considering?
Well, they should understand, number one, that more than likely their insurance will cover it. I know that's been kind of a stumbling block for people in the past, but most cases they cover it, but there is a process that people have to do in order to get the operation. Most insurances are going to require that you tried some kind of medically supervised weight loss in the past and that you went for a number of months, and that's different for each insurances. We also will, if you join our program, will help to prepare you by meeting our dietitians, working with them. You'll work with our physician assistants, of course, the surgeons, and also our psychiatrists in order to get ready for the operation.
So I mentioned there are new guidelines for adults wanting weight loss surgery. Can you tell me a bit about the new guidelines?
Yeah, so interestingly, the old guidelines were from almost like 23 years ago, where the NIH had met and they decided that they looked at the risks and benefits of the operations, and they saw that even though surgery had risks even over 20 years ago, not dealing with your obesity was more risky than not doing surgery. We knew that as surgeons, and so we've been dealing with these old kind of guidelines for the last 20 years, and basically said if your BMI was over 40, you should consider surgery. If your BMI was 35 or greater and you had comorbidities like diabetes or obstructive sleep apnea, you should consider surgery. But now they've actually lowered the BMI threshold down to 30 with diabetes. And so, there's like 70 to 90 million people in the United States with diabetes and obesity that could really benefit from what we call our metabolic surgery that we perform.
I understand the NIH has also released new guidelines for teenagers seeking weight loss surgery. Can you tell us about those?
So yeah, unfortunately, if you are an obese teenager, your chance of being an obese adult is very, very high. It's very hard to break away from that obesity. And just like with the adult recommendations, the recommendations for peds is very similar. If your BMI is over 40, it's recommended that you would consider it. And if your BMI was greater than 35 and you have diabetes or another serious medical condition related to obesity, even teens should consider it. We don't do pediatrics here in Grand Rapids, but there are other places, I believe in Michigan, of course, across the country that have started to do weight loss surgery on teens with success. And so,
why should people consider Corewell Health if they decide that this is for them? Why you folks?
Well, we have, probably the greatest experience of any other, group, maybe in the Midwest. There's a lot of bariatric surgeons here in Michigan. We are accredited by the MBS QAIP, which means that they collect our data, they visit our site, they make sure that we do quality work and quality surgery. And most insurances would require that you are accredited in that fashion. Also, at Corewell, we've joined forces with the other surgeons from across the state now. We have what's called the Michigan Bariatric Surgery Collaborative, where the surgeons actually meet 3 times a year, and we try to do best practices from all the different hospitals across the area. Fortunately, we're always one of the high performers in surgery, so a lot of things that we do have been kind of in the forefront of bariatric surgery, and so having that collaborative with other surgeons, we can make surgery in Michigan the safest of anywhere in the world.
Very nice. All right. Well, to learn more about the surgical weight loss process, Corewell Health offers a free seminar. The surgery and seminars are available at various locations throughout West Michigan. You should call 616-267-7400 or visit spectrumhealth.org and search bariatric surgery to find out a location near you. Dr. Foote, thank you so much.
You're welcome. Have a good day.
You too.